Electronic cigarettes have been causing controversy since their arrival. Now, Toronto Public Health is hoping to snuff out the debate altogether. Tracy Tong is live with how Toronto Public Health is thinking about severe restrictions brought in where e-cigarettes are concerned. Tracy?
Well, Gord, you'll remember the controversy when the smoking ban came into effect in enclosed public spaces. Well, now health officials want these e-cigarettes to be included in that category. And while the health impacts are still a gray area, they say that they're still a threat.
We know it's a growing phenomenon, and we don't want to wait till it's a big problem.
Toronto Public Health wants e-cigarettes to go up in smoke. A report going to the Board of Health will ask the province to amend the Smoke-Free Ontario Act, banning the use of e-cigarettes from wherever smoking is already prohibited, like in closed public areas or workplaces.
Some people try to smoke them indoors, and I think they're kind of odd looking if you do that.
You got the e-cigarettes. It's something that'll help us quit, and now you want to shun these people as well. I don't think it's fair.
The main concern for public health is that it will normalize and encourage smoking.
It may be a gateway for youth to start, if they don't smoke cigarettes, to start with e-cigarettes and then move on.
Well, it's kind of smoke and mirrors when it comes to regulating the sale of these things. While you have to be at least 19 years old to buy real cigarettes, there's no age restriction on buying e-cigarettes. Right now, e-cigarettes can be purchased by any people of any age?
Technically, yes. There's no restriction. They can be sold to minors.
Even if they contain nicotine?
Well, they're not supposed to be, but they are. We know that it's happening.
I encourage regulation. I think it's a good thing. I think if the government gives us some sort of direction, it will only help our industry.
E-cigarettes and vapes are a new category on the rise, but regulation is hazy.
I think it's a new product. It's almost a new category. Should it be labeled as a tobacco product? No, because it's not a tobacco product. Should it be labeled as a medical device? Well, no, it's not a medical device either.
What exactly is in an e-cigarette is really up to the manufacturer. Here at Easy Vape, they know what's in theirs.
There's 4 components in e-liquid: propylene glycol, vegetable glycerin, flavor extracts, and nicotine, with or without.
Public Health says research on vapor and how harmful it is still in its infancy.
Well, it's very early days for research, and it's inconclusive. We do know that the person inhaling is inhaling some harmful products.
So that report will go to the Board of Health next week and then to the province after that. But Toronto Public Health officials say that even if the province is not on board within 6 months, they will try to implement it within the city of Toronto anyway. Now, right now, that ban is already in place in Red Deer, Alberta and Innisfil, Ontario. Live at Yonge and Dundas, I'm Tracy Tong. Gord, back to you.